Hello, Jakob Knudsen, CEO of ViroGates. Your company received some very good news yesterday. Thank you for taking time to talk to us about that today.
Thank you for allowing me to talk a little bit about yesterday's announcement from the CHMP, which is the advisory board to the European Medicines Agency. The important news was that there was a proposed label extension for a drug called Kineret, a drug marketed by Swedish Sobi. And the important news for us was that it is a label extension allowing the usage of Kineret, but suPAR-guided treatment of Kineret for COVID-19 patients. So we fit into the label and we are prominently mentioned in the label, and that's why we are so happy about the news.
Great. And just to take a few steps back, why is it so important to screen for suPAR before administering anakinra? Why not give anakinra to any patient who is suffering from a severe case of COVID-related pneumonia?
Yeah, without dwelling too much on the immunological mechanisms, it's important to note that the inflammatory system in immunology is actually designed to help us cope with the disease. And that's a normal reaction in most patients that are encountering the coronavirus. The inflammatory system actually gets started, the cells start signaling to each other, and a lot of immunological mechanisms are taking place, and that takes care of the infection. However, in some patients, especially the ones that are affected by chronic inflammation and are more sort of weak in their immunological capabilities, where the inflammatory system is occupied elsewhere, they have what is known as a hyperinflammatory status or a cytokine storm. That means basically that the immune system overreacts to the viral infection. And that's a very dangerous state to be in, and therefore we need to dampen that inflammatory response. And that's exactly what is done with Kineret. On the other hand, you don't want to dampen that response if the inflammatory system is actually helping the patient. So that's why suPARnostic is so vital in guiding whether to dispense the drug or not.
I see. But how does suPARnostic guided anakinra treatment fit into COVID-19 now that you also see a launch of tablet treatments?
Yeah, again, the tablets are mainly antiviral treatments, so it's very important for the tablets to be dispensed actually extremely early during the infection, and often before symptoms may be encountered, because that's where the viral load is increasing, and that's what you dampen by ways of the tablets. So it may often be too late to do the tablet treatments, and that's where the anakinra or Kineret drug is so suitable. So when the patients encounter maybe respiratory difficulties, that's where suPAR-guided anakinra plays a role, because it affects the immune system rather than this viral infection and the increase in the viral load.
I see. And what do you think about your existing and prospective customers for suPARnostic products? How do you think they will react to the news of the label extension?
Yeah, again, it's very important for me to stress once again that suPARnostic is not a specific COVID-19 or coronavirus diagnostic product. So we are all about still triaging or risk stratifying patients when they come into the acute medical departments. But the medical communities are used to diagnostic products like ours to be associated with some sort of intervention, and this gives us a very tangible intervention in the form of a drug treatment for the patients that have suPARnostic levels above 6 nanograms per mil and respiratory problems. So it's very concrete, very tangible for the physicians, and that's why we expect this to be a good catalyzer for being implemented into the acute medical systems. And then obviously we want to talk later on to the customers about extending this into the general triage and risk stratification of medical patients when they hit the wards in general.
Now, you have a portfolio of different suPARnostic products. Which one of them do you think will benefit the most from the opportunity of being used in connection with anakinra?
Again, that's a good question, and we obviously have developed a portfolio that sort of suits different customers' needs. So it depends really how many of the patients that these hospitals see. So if it's a smaller hospital unit and they see maybe 2 to 3 likely candidates for this treatment a day, they would typically use our quick triage, the lateral flow product. If they see somewhat more, and that's the general tendency that we see, that there's a consolidation into larger hospital units now with the severe patients, and they may be seeing 10 or 15, 20 patients a day with these respiratory problems and coronavirus, then they would likely favor our product, the suPARnostic TurbiLatex, and implement that. And that's also why we see that we're ready also for general triage at a later stage.
I see. And finally, does the news of label extension in any way affect your priorities within ViroGates going forward?
Well, in the short term, obviously, we, along with our friends and colleagues at Sobi, will be marketing this proposition to the medical community. So we will be supporting the sales team at Sobi, addressing the labs with our solutions, because that's where our strong force are. And Sobi will concentrate obviously on the medical calls. So on the short term, we will be very busy with this. On the longer term, again, we will be stressing that the best use of suPARnostic is actually for general triage, even when we hopefully at a later stage have combated this coronavirus.
Okay, thanks very much. And so just remains for me to say congratulations and good luck going forward.
Thank you very much, Alf.